And regarding the most common ligaments that located mainly in the thoracic region, we have here, for example, we have couple of ligaments that hold the vertebral column in our upright position, and it's clear here. Look at the thoracic vertebra here, and say this is the body of, or the bodies of the vertebrae. So there is a ligament, broad ligament here, a strong broad ligament anterior to the vertebral body, and there is another one which is really like cord structure directly behind the body. That means you have a ligament anterior directly to the body and one posterior directly posterior to the body. So there's one, the long one. This is the anterior longitudinal ligament. It's broad and strong, and it prevents the hyperextension. While, for example, if you move back your back, right? So on the other hand, just directly posterior to the body of vertebrae, you have another longitudinal ligament, which is not anterior, it's indeed posterior, because posterior to the body, so right? So we call it the posterior longitudinal ligament. Yes, it's smaller than the anterior one because it's like cord-like structure. If you see here is the anterior, my friends, and here is the you see the posterior, which is like cord-like structure. It's weaker than the anterior, that's fine, but it prevents the hyperflexion, right? You just imagine how you do a flexion, and it prevents the over or hyperflexion, right? So it passes posterior to the surface of vertebral bodies. And if you dig deep here, look at the vertebral canal here, or what we call it vertebral foramen, right? So the posterior longitudinal ligament, it forms and the anterior surface of the vertebral canal or vertebral foramen, right? Because it's anterior, because it's posterior to the vertebral body directly, but still it's anterior to the vertebral canal or foramen. So it forms the anterior wall of it. Okay, what we have other than the anterior and posterior longitudinal ligaments? Yes, we have, if you move away from the back here, away from the body, sorry, to the back, look at these processes. So there is a ligament between the tips of the spinous processes. This is the spinous process, and so forth. So between the tips of spinous processes here, you have this ligament. We call it supraspinous ligament. Not interspinous. It's supraspinous because it connects the tips of spinous processes, right? The tips of spinous process. We call it supraspinous ligament. Now, between the spinous processes themselves here, this is called interspinous. That means you have supraspinous and interspinous ligament. On the other hand, we move a little bit anteriorly from spinous process. You have the lamina here. So between the laminae here of the above and below vertebrae, you have ligamentum flavum. These ligaments, which is passes between the laminae of adjacent vertebrae, and indeed it forms the posterior surface of the vertebral canal. The posterior, you remember who's the anterior? The anterior, this is the vertebral canal. The ligament that forms the anterior wall of it is the posterior longitudinal ligament, while between the laminae here, you have the ligamentum flavum that forms the posterior wall of the vertebral canal there, right? Remember, this is the intervertebral foramen, not vertebral canal, right? You go back in the lecture, then you will get an idea about the vertebral canal or vertebral foramen, right? Okay. Now, shifting back to the intervertebral discs and the vertebrae here and the intervertebral disc in between, right? So, for example, this is a real cadaver you see here, and there's a cross section through the lumbar vertebrae. Anyway, lumbar or thoracic, it doesn't matter. We want to get the idea about the I want you to get the idea about intervertebral disc. Here you can see the intervertebral disc through the sagittal section, and the disc, as you see, is like thick here, like this cross section from the lumbar area. So in the lumbar area and in the cervical area up in the neck, if you notice that the intervertebral disc is a little bit thicker than those in the thoracic area. But anyway, why? Because there is a lot of movement there, and you need to improve the flexibility. Anyway, so the disc provides compressibility of the spine and resists the tension of the spine. Any extra pressure on it can lead to flatten it, and sometimes it gets like herniated to the vertebral canal, right? Herniated to the back. So if you take a cross section or if you look to the intervertebral disc here superiorly, you will find it's like a circular, kind of circular shape. It takes the shape of the vertebrae where it's located there, and it's composed from two parts, this outer part and inner part. The outer part, we call it annulus fibrosus. This is the annulus fibrosus, in which it's in blue color. So this is the annulus fibrosus. Even the annulus fibrosus itself can be divided into outer ring and inner ring. The outer ring from collagen here, and the inner ring is like mainly fibrocartilage, right? Now, let us move a little bit to the second part here in the middle, which is indeed called nucleus pulposus. It's in the middle, so we call it nucleus, but the outer one is annulus, because annular, that means like a circle, right? Annulus fibrosus, from its name, it's mainly from fiber, the outer one, right? Should be strong to include the gelatinous mass here, the inner one, that's called nucleus pulposus. The gelatinous mass, its function is to absorb the compression between the vertebrae. Look at it here. So in case if there is extra pressure, the nucleus pulposus can be herniated to the vertebral canal, as you see here. This is a herniated, we call it herniated disc, and it creates a pressure either in the spinal cord itself or in the spinal nerve related there. So in this MRI of sagittal lumbar area, so this is from lumbar area, sagittal section. So this is let us say this is a lumbar vertebra here, and in between you have intervertebral disc. Look at the intervertebral disc here, is like intact and it's normal. This is the vertebral canal in the back, or vertebral foramen, right? Vertebral, because vertebral foramen, all together they form vertebral canal. So this is a vertebral canal in which there is a spinal cord and cerebrospinal fluid. Anyway, look at this, which is between I would say L5 and S1, the sacral, because this is a sacrum, right? So look at the intervertebral disc. It's like herniated in the back, and it creates a kind of a pressure on the spinal cord and coda equina, right? Look, it creates a kind of pressure here. So this is this disc, we call it herniated disc in which the nucleus pulposus herniated to the back, right? Lastly, I would like to show you the joints that form, because already we covered the ribs and the thoracic vertebrae, and you know the close relation and the articulation between ribs and thoracic vertebrae. So of course there are a couple of ligaments and couple of joints there. They are pretty easy and direct forward. When you say the articulation between the ribs and the thoracic vertebrae, of course, you are talking about synovial joint. And you know from the previous, what we mentioned earlier in this lecture, that the head, look at the two facets of the head of the rib. You know that the head of the rib, for example, say this is number 5, so it articulates with the body of the thoracic vertebrae number 4 and number 5. And you know the head of the, as I mentioned, I will just repeat it again, that the head of the rib has two facets or demifacets. One is the upper one and the lower one. You know that the lower facet articulates with the same corresponding vertebra, and the upper facet articulates with the vertebra above it. That means with number thoracic vertebra number 4, and we discussed that in details earlier. And also we mentioned that the rib has, other than the head and neck, it has a tubercle. A tubercle, you know, it has two parts, articular part and non-articular part. And you know that the articular part here of the rib, it has a facet, and this facet for the articulation with the transverse process of the same vertebra. That means this is thoracic vertebra number 5, say, for example, and this is the transverse. Look at the shadow here, the shadow behind the rib. This is the transverse process. For example, this is thoracic vertebra number 4. Look at the transverse process. The transverse process has a facet here, and also number 5 has a transverse process and facet here. But rib number 5 will articulate with the transverse process of the same vertebra. That means there is articulation again between the rib and the vertebra, in which through the head and through the articular part of the tubercle. So we a typical rib articulates with the vertebra, as written here. You know, the body forming joint with the head of the rib, and transverse process for what we call it costotransverse joint. We'll talk about each type of these joints. Anyway, both are synovial joint. Which type of synovial joint they are? They are plain synovial joint, right? And mainly their function, especially in the upper ribs, to it allows them to rotate, and while you move down to the lower rib, it gives them like an ability to move up and down. Especially this is very important during the breathing, you know, that the chest should be like inflated and deflated, so it should move, right? The joint with the head of the rib to the vertebrae, there already I explained that to you, but let me show you here. We exposed that joint, and let me iterate again. This is the rib, say for example number 5. That means it articulates with the upper demifacet here of vertebra number 5, the same number, and with the lower demifacet of the vertebra above it, that means number 4. Anyway, look at the joint here, in which the rib has upper and lower demifacet, and so each one, you know, articulates with the corresponding part. And look inside the joint itself. You remember the crest of the head of the rib, this protrusion of the head of the rib, called the crest of the head of the rib, it connected to the disc by intra-articular ligament. Let me erase it and show you here. So simply, let me change. Here is the crest. There is the crest of the head of the rib. So it's connected by intra-articular ligaments. This is a small ligament called intra articular ligament connects the crest of the rib to the intervertebral disc. Anyway, look, this intra-articular ligament divided the cavity there into two compartments, right? Two synovial compartment. Anyway, the whole joint, my friends, because synovial, that means it's surrounded by a capsule, right? Joint capsule, right? So this is the part of the what we call costovertebral joint, the part with the head, right? Joint with the vertebral body. Now we finished this. What about this? The costotransverse joint. Again, a synovial joint, as you know, and as I mentioned earlier before 2 slides, that this joint between the, do you remember the tubercle of the rib? You can go back and watch it. So there is a tubercle for the rib, one articular part and one non-articular part. So the articular part has a facet here for articulation with the facet of the transverse process of the same vertebra. That means this is rib number 5, this is vertebra number 5. So this is the transverse process of the vertebra number 5, right? So again, here you can see here is the articular part of a tubercle of the rib, and here is the transverse process, and you know the transverse process has a facet here for articulation with the tubercle of the rib. So this is not the end of the story of this kind of joint, for what we call it costotransverse joint. Costo, you know, costo because of the rib, and transverse because transverse process. Costotransverse joint stabilized by two extracapsular ligament. The first one, my friends, is like or 2 or 3. So look at the rib here. So this is the head, this is the neck. So very simple. How to memorize it? First of all, what's the name of this joint? It's costotransverse joint. That means the first one between the neck and the transverse process, it has the same name, costotransverse ligament. Now, you remember we said that the tubercle of the rib has articular part and non-articular part laterally. The articular part has a facet, articulates with the facet of transverse process, but the non-articular part of a tubercle, it connects to a ligament and to the transverse process, right? This is and we call it to like distinguish it from the costotransverse ligament, we call it lateral one, lateral costotransverse ligament, right? This is the lateral costotransverse ligament. So the same name. Also, we have another one, but indeed from the neck, but up, right? Here is, you can see it here from the neck of the rib, but up, it attached to the neck of the rib to the transverse process of the vertebra above it. We call it not lateral, no, we call it superior, because here is the lateral. Here is the superior costotransverse ligament. That means all of them, they have the costotransverse ligament, but one, you know, the costo, and one lateral and one superior, right? And you know where they are. Now, you know that the sternum articulates with the first 7 costal cartilage, right? And this joint, we call it sternocostal joint. This is the sternocostal joints here, what you see here. So it's between the upper 7 costal cartilage and the sternum, very simple. But there is one exception here, my friends, the first rib. Or after a while, this will be ossified and calcified. Why? Because it's not synovial. The first rib is not synovial because the kind of joint here, the joint, I mean, between the first rib and the manubrium is a cartilaginous joint. It is cartilaginous joint. The name, we call it, fibrocartilage. Fibrocartilaginous joint, or you can say cartilaginous joint. So It's not synovial, it's fibrocartilaginous joint. What about the rest? No, the rest are from the second to the seventh, they are synovial joint, and they have a thin capsule. They have a thin capsule. Of course, enforced by the same name, a similar small ligament carries the same name, so we call it sternocostal ligament. Sternocostal ligament. Here, if you need to dig deep more in that joint, just the second one. It has like two compartments, you see? You know why? Because it articulates with the vertebrum and with two demi facets, right? With the one with the manubrium and one with the body of the sternum itself. Again, we have the last two joints, my friend, between the manubrium and the body of sternum, and between the body of sternum and zygotal process, and we explain that earlier. But the joint between the manubrium and the body of sternum, we call it manubrio-sternal joint. This is the manubrio-sternal joint, right? And the joint between the body of sternum and the zygotal process, we call it xiphi-sternal joint, right? And which kind of joint they are? They are fibrocartilaginous joint. Fibrocartilaginous joint. Which type of fibrocartilaginous joint? Symphysis, right? So that means it permits a little bit of movement. For example, the manipuro-sternal joint, it allows just only slight angular movement during the respiration. While the xiphi-sternal joint, it becomes like, with time, it becomes like ossified with age, right? Sometime during the CPR, it's prone to be like, it's prone for fracture, right?